There has been a significant increased rise in the number of individuals suffering from Alzheimer's dementia. The medical literature is very clear that the root of the underlying cause of Alzheimer's is a result of the dark side of oxygen, which is called oxidative stress. The day physicians actually diagnose their patients as having Alzheimer's, 80% of the brain cells have already been damaged. Therefore, it has been noted in several studies that it is next to impossible to reverse the disease in any meaningful way. However, researchers have been very interested in finding ways that could help slow down the decline of this disease, which would allow for an individual with Alzheimer's to live at home much longer. Well, this was the desire involving a clinical trial that was just reported in the January 1st, 2014 issue of the Journal of the American Medical Association. These researchers studied over 600 patients who had mild to moderate Alzheimer's dementia and placed them in 4 separate groups. There was a placebo group, a vitamin E supplement group, a vitamin E supplement group along with a drug approved for treating severe Alzheimer's dementia called memantine, and a group receiving memantine alone. They were followed for nearly 2.5 years, and their decline was closely evaluated throughout the study. The researchers were amazed that the group that supplemented with vitamin E alone actually delayed the clinical progression of their disease when compared to the placebo group by nearly 20%. This effect was not seen in the group receiving vitamin E and memantine or the group receiving memantine alone. Not only did this study show this significant delay in the progression of the Alzheimer's disease in the vitamin E group, but also a slowing of functional decline and decreasing the caregiver burden. This is just another study that shows the effectiveness of nutritional supplementation in a very difficult disease. What is so amazing to me when I read a study like this is the fact that these researchers are only studying one nutrient, vitamin E. What makes it even more amazing is the fact that in this study they didn't even use a natural vitamin E or a mixed vitamin E. They actually used a synthetic vitamin E, which has been shown to definitely not be as effective as natural vitamin E, and in some studies to actually have some harmful effects. Vitamin E is not a drug. It is simply a nutrient we get from our foods. However, because of supplementation, we can now get it at levels we can't obtain from our foods. Once you realize that the root cause of Alzheimer's dementia is oxidative stress, the best defense against this disease is our body's own natural antioxidant defense system. The best way to optimize your body's natural antioxidant defense system is by consuming high-quality, complete and balanced supplements that provide what I refer to as cellular nutrition. Cellular nutrition is defined as consuming all these essential nutrients, not just vitamin E, at these optimal or advanced levels that have been shown to provide a health benefit in our medical literature. Whenever I have a patient who has just been diagnosed with mild to moderate Alzheimer's disease, I recommend that they take cellular nutrition, which contains vitamin E, and add certain enhancers like CoQ10, grapeseed extract, fish oil, that have also been shown to slow the decline of Alzheimer's dementia.